In just about every interaction with a healthcare professional, no matter if it's a nurse or a lab assistant or a doctor like me, there is a very good chance you're going to get screened for high blood pressure by having your blood pressure measured. But what does it really mean to you, and what feedback should you get from your healthcare provider with respect to your results? My name is Dr. G, and I'm an internal medicine physician in Hollywood, Florida. I'm also a lifestyle modification coach and a patient educator. Nearly half the adults in the US have high blood pressure, or also known as hypertension, and that's defined as systolic blood pressure, or the top number, as my patients like to call it, and that being higher than 130 millimeters of mercury. On top of this, hypertension increases with age. Hypertension is identified in 22% of adults between the ages of 18 and 39 years old, and 54% of adults between the ages of 40 and 59, and 74% of the adults older than the age of 60. The incidence of hypertension also varies between races. 57% of non-Hispanic blacks have hypertension, 47% of Hispanics, and 43% of non-Hispanic whites have hypertension. Hypertension is less probable among college graduates than those with high school education or less, which is very interesting, and we really don't have a reason for that. Only 1 in 4 adults with hypertension have it under control in the US, and hypertension ends up costing the US healthcare system about $131 billion a year. Worldwide, the number of people with hypertension is estimated to be about 1.3 billion adults. That is a ton. Apparently, blood pressure is important from a health standpoint, so do you have a good understanding of what blood pressure is, what it means to have high blood pressure, and what the risks are if you don't control it? Or finally, what you can do about it even before taking medications to control the blood pressure and keep your blood pressure controlled. We're not going to get too technical about this, but after this video, you will come away with better informed about high blood pressure and what you can do about it. If you want to know some of the more detailed aspects of high blood pressure and its management, I've included all the links you need to know or to need to review to be well informed. So let's dive into this video. Let's define first what blood pressure is. In a nutshell, blood pressure is the force exerted by circulating blood on the walls of the arteries as the heart pumps the blood throughout the body. It's a vital sign that indicates how efficiently the heart is working and how well the body is being supplied with oxygen and nutrients. Okay, so how does blood pressure produce? What makes blood pressure? Blood pressure is primarily created by the heart as it contracts or squeezes blood out to the blood vessels all over the body, and then relaxes to accept another round of blood from the body and the lungs. This cycling of contraction and relaxing is called the cardiac cycle. This interaction between the heart's pumping action and the arteries' ability or capacity to accommodate, meaning it can relax to accept blood flow, determines overall blood pressure. It gives you the top number and the bottom number of your blood pressure. 2 key components create and regulate blood pressure. And that's number 1, the cardiac output. That's the squeezing and the relaxing of the blood. Each time it does that, pushing out a certain amount of volume out into the blood vessels, the arteries. And then number 2 is the vascular resistance, how much the arteries can relax. It's the resistance of the blood vessels to blood flow. The higher the resistance, the higher the pressure. So this interaction between the heart's pumping action and the artery's capacity to accommodate blood flow determines overall blood pressure. What does all that mean? It means basically the blood pressure it's in the interplay of a lot of things, including blood volume, blood viscosity, and hormones. Hormones regulate blood pressure as well, but mainly the blood pressure is given or measured, and it can go up and down depending on how strongly the heart can contract, how many times it can contract in a minute, and also how much volume is within the arteries and how well those arteries accept the blood with every single pumping of the heart. So let's move on to how blood pressure is measured. Typically, just about everybody's had a blood pressure cuff on, and blood pressure can be measured. It can be done manually using what's called a sphygmomanometer, a stethoscope, or sometimes, and many times nowadays, you get these automatic digital ones where you can use them at home, and they're most commonly used at home and can be used in a clinical setting as well. So the sphygmomanometer is actually comprised of an inflatable cuff an actual gauge to measure and so you can see the numbers, and the actual sensor if you're doing the automatic blood pressure cuff, and a stethoscope to be put in, to the practitioner's ear to listen for the actual pumping of the blood through the cuff. And everybody's had this process before. It's pretty simple and typically painless. You're placed in a seated position, typically feet on the floor, flat on the floor, relaxing, not talking. Cuff is on the arm, it inflates, and then the cuff slowly deflates, and the blood pressure is monitored through the cuff, either by the ear of the practitioner or the actual machine takes a measurement and it reads on a digital display. And the number is expressed as usually in the United States or in millimeters of mercury, a 2 or 3 digit number on the top, and typically a 2 and hopefully never a 3-digit number on the bottom. The top number is called the systolic blood pressure, and the bottom is called the diastolic blood pressure. The top number represents the heart squeezing down and pushing out blood throughout your body, and the bottom number is representative of the whole system relaxing to recycle for the next heartbeat. Yeah, that's you just learned the cardiac cycle in about 3 minutes. That's pretty awesome. So in conclusion, about normal blood pressure, let's just button all this up and we can move on to hypertension. Blood pressure reflects the overall health of the cardiovascular system. Proper measurement and understanding of blood pressure helps us to assess risks for conditions like hypertension, heart disease, and stroke. So let's define what hypertension is. Hyper meaning above normal blood pressure. According to the American Heart Association, or the AHA, and the American College of Cardiology, the ACC, hypertension is defined as a consistent systolic blood pressure, the top number, of 130 millimeters of mercury or higher, or a diastolic blood pressure, the lower number, of 80 millimeters of mercury or higher. This classification was updated in the 2017 AHA-ACC guidelines. It's been updated. It's one of those things where, there can never really find a consensus. We had different categories and stages and different levels of blood pressure. The one in 2017 showed normal blood pressure being about up to 120 millimeters of mercury for systolic, and then up to 80 millimeters of mercury for the diastolic. In every step, about 10 millimeters of mercury, it would go up to elevated hypertension stage 1, and then hypertension stage 2 was basically anything above 140 millimeters of mercury for the top number, and the diastolic number, if it's above 90 consistently, would be stage 2 hypertension. Hypertensive crisis, on the other hand, is anything that's above 180 systolic or 120 diastolic, and some sort of, end organ damage. You can't see, having a stroke, kidney disease, or kidney failure, acute kidney failure, heart attack, anything, even liver failure in the acute setting, in the sense of high blood pressure like that, was called hypertensive crisis. So we have different categories, but for all intents and purposes, for the office, for you walking around, you want to keep it less than 130. So the reasons why do we have hypertension? Typically is one, primary hypertension, also known as essential hypertension, which is by far the most common form of hypertension, has no identifiable cause, and it's thought to result from a combination of genetics, overall lifestyle, and some environmental factors. Like I said, your genes, what you got from mom and dad in your family, your poor diet, maybe high in sodium, low in potassium, obesity, being overweight, decreased physical activities, high stress, and excessive alcohol consumption, just to name a few of some of the risk factors for essential hypertension. Then we have the other category, which is secondary hypertension, and this results from an underlying medical condition or use of certain medications. Common causes could be kidney disease, obstructive sleep apnea, thyroid disorders are classified as a cause of secondary hypertension, certain medications like NSAIDs, some birth control pills, decongestant medications that we use when we're sick, some adrenal gland tumors, just to name a few. So let's talk about some of the most common outcomes of hypertension. And this is what we're trying to avoid when we leave hypertension untreated for too long. So if left untreated, hypertension can lead to several severe health complications, including heart disease. And heart disease is still the #1 killer in the United States, preventable killer in the United States. And hypertension is a major risk factor for coronary artery disease, heart failure, and heart attacks, or sudden cardiac death. Stroke is another complication that we would never like to see, and elevated blood pressure increases the risk of ischemic and hemorrhagic strokes. Kidney disease, which is also a large reason for comorbidity for patients over the age of 50, I would say, 50, 55, and going on higher as hypertension gets more and more prevalent. And chronic high blood pressure can actually damage the kidneys, leading to chronic kidney disease or kidney failure, requiring dialysis. Then you got aneurysms, which is basically hypertension causing a weakening in the wall of a blood vessel, and it can cause bleeding, can cause a stroke, and could cause a localized issue in the brain or wherever it is. It could be in the thoracic cavity as well. Vision loss can be linked to hypertensive retinopathy, meaning damaging of the retina because of high blood pressure, and can be permanent. So let's talk about some of the most common recommended medical treatments for hypertension based off of the ACC and the AHA providing evidence-based guidelines for the treatment of hypertension, which is periodically revised, like I said before, and they prioritize, and believe it or not, my favorite thing, lifestyle changes, followed by then pharmacological treatments. So number one on the list, and thankfully so, it's lifestyle modifications. Things that you can do is considered for first-line recommendations, such as the DASH diets, emphasizing fruit and vegetables, whole grains, low-fat dairy products. Then you can get, then the recommendation is for sodium reduction, limiting sodium intake to less than 1,500 to 2,300 milligrams per day is also recommended by both the ACC and the AHA to control hypertension as a lifestyle modification. And the second part of lifestyle modifications that I love to teach all my patients is increasing regular physical activity to at least, the magic number, 150 minutes of moderate intensity exercise per week, the optimal number being 200 minutes per week. Now, the lifestyle modifications themselves are, changing your nutrition and changing your exercise. That is without attacking weight loss. And weight loss itself, promoting weight loss, even just a 5 to 10% reduction in body weight can significantly lower blood pressure. Many times when we have our patients come in and they are obese or morbidly obese, that's one of the recommendations, because we know tying in weight loss will also decrease blood pressure over time. Limiting alcohol. Restricting alcohol to 1 drink per day for women and 2 for men is also part of the guideline therapy for the AHA and the ACC. I want to take a step back to what I said before about the nutrition part, the DASH diet. And the DASH diet is DASH, and it stands for the Dietary Approaches to Stop Hypertension diet. And it emphasizes whole grains, fruits and vegetables, and low-fat dairy, like I said before, while also reducing saturated fats. This approach can actually lower blood pressure by up to about 11 to 13 millimeters of mercury in some people. It's one of the things that we introduce as a possible nutrition change for many of our patients. But that's not the only way. You can also try the Mediterranean diet, which is rich in olive oil, fruits, vegetables, and whole grains. This diet has also been shown to significantly reduce blood pressure, and especially in our older population. We often talk about reducing sodium, like I mentioned before, the top recommended intake being around 2.3 grams a day. But there's also a lot of evidence that optimizing potassium is also a good way to maintain low blood pressure. Potassium helps balance the sodium levels in the body and supports lower blood pressure. And you can get potassium from foods like bananas, leafy greens, and potatoes. It's best to optimize the potassium by checking your actual potassium levels. If they're low, then yeah, you should be replacing them to make them within the normal range, if you can. Now, if you shouldn't just blindly replace the potassium, but it is represented as one of the possible ways to control your hypertension without the use of medications. Here's one that we don't talk about as much, and found that towards the bottom of the list of ways to reduce your blood pressure without the use of medications, and that's stress reduction. Chronic stress can increase blood pressure, so relaxation techniques like meditation, biofeedback, and deep breathing exercises may help reduce stress and support lower blood pressure. Quit smoking. definitely needs to be talked about when you're dealing with high blood pressure. Smoking increases blood pressure immediately after each cigarette. So quitting can significantly reduce your risk of hypertension and heart disease. I recently had a comment of a patient or a person in the comment section who seemed to be so surprised that patients who smoke cigarettes die more. Yeah, they die more. Yeah, we're all gonna die, but if you put them side by side, smokers versus non-smokers, and make everything equal and account for all of the other factors, being diet and food and everything else, weight, the group that smokes consistently dies more. They die at a more increased rate than the group that has no history of smoking. That's just the way it is. You can't run from that, okay? So we've gone through just about all the lifestyle modification things, the things that you should be doing or can do before you have hypertension, or to make sure that you don't get it, or if you do find that your blood pressure is running high, that you can do these things before we even touch any of the medications that are recommended. So these strategies, doing them on a more consistent basis, can lead to significant improvements in your blood pressure and your overall cardiovascular health. The next step, if all of that, you've done your best, doesn't work, is pharmacological treatment. And when lifestyle changes alone are insufficient, or in the cases of stage 2 hypertension, it's recommended that medications are started. We're not gonna go through all of them. That's not the point of this video, but just wanna mention some of the ones that your doctor may try in order to get your blood pressure better controlled or in a quicker fashion. You have diuretics as a class, water pills, most people like to call them. ACE inhibitors or ARBs, those are ones that have been around and work on the level of the kidney. Calcium channel blockers work on basically in the level of the heart and the arteries, relaxing the heart and relaxing the blood vessels. You have your beta blockers, used in more specific circumstances, but still on the list of agents that we can use. Then we have a myriad of other things that we can use, vasodilators and things called alpha blockers and central agonists, a bunch of other medications that we've been trying to control blood pressure for so long. We've grown a lot of knowledge on, some of the ways that we can intervene on the blood pressure. But again, not the point of this video. We're talking about how you can do your best at changing the course of hypertension, which is a common multifactorial condition that requires a combination of lifestyle changes and medications in some patients. And the primary goals of treatment are to reduce cardiovascular risk, prevent complications, and lower blood pressure to safe levels. Like I said before, the ACC and AHA guidelines, which you can find in the links below, provide a structural approach to managing this condition and ensuring better long-term outcomes and less comorbidity as you get older. The takeaway here is, with the power of lifestyle modifications and patient education, we can avoid the need for high doses or multiple medications. If you feel you need a more personalized coaching for your lifestyle modification goals, go ahead and check the link in the description below to set up a counseling session with me. Thanks for watching, and remember, health is a journey, not a destination. Take it one step at a time and stay informed. Stay healthy, and I'll see you soon.